Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale of Two Hygienists in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hey everybody, Tom Viola with Pharmacology Declassified. We get another Fast Facts Pharmacology Edition. Well, we've covered cardiovascular disease. Now it's time to turn our attention to diabetes. Well, we all know that there's a relationship between systemic inflammation, cardiovascular disease, and diabetes. And one of the causes of systemic inflammation is periodontal disease. So you could make the argument that there is definitely a triad between periodontal disease, cardiovascular disease, and diabetes, or really systemic inflammation, atherosclerosis, and insulin resistance. So it's time to talk about diabetes. And the first thing I've got to ask you is, how many different types of diabetes are there? It turns out that there's 5 in my opinion, and many people shake their head and say, how could there be 5? Well, let's go over each one and we'll figure it out. Well, first off, diabetes insipidus is not really diabetes at all. Diabetes insipidus is caused by, relatively rare condition, but it's caused by a relative deficiency or relative insensitivity to antidiuretic hormone, or ADH, also known as vasopressin, which means that it's really difficult for the patient to concentrate their urine, and therefore they urinate a lot and kind of resemble somebody with uncontrolled diabetes. So while diabetes insipidus is named diabetes, it has nothing to do with blood sugar. If anything, it has to do with this relative lack of or relative insensitivity to this hormone, antidiuretic hormone, therefore nothing to do with our type of diabetes that we're discussing at the moment. Well, of course, after that there's type 1, which we often refer to as juvenile onset, but it can occur in adults as well, usually when the adult's immune system is stimulated or sensitized, maybe by viral infection or high fever. It's found that, of course, this is an autoimmune disease where the immune system destroys the islet cells in the pancreas, and therefore the person's ability to make insulin is gradually, over time, decreased to the point where they can no longer make insulin, and therefore they become insulin dependent. Type 2 diabetes is often thought of as adult onset, but it can affect children as well, and that's really due to a over time, long-term burnout of those same islet cells. To the point where some type 2 diabetics, although they've been non-insulin dependent most of their lives, as they get older and they age, they actually end up becoming insulin dependent, just like a type 1 diabetic. Maybe not to the same extent, but certainly their insulin production is decreased to the point where they need supplemental insulin. Type 3 diabetes, quote unquote type 3, is really the diabetes of pregnancy, also known as gestational diabetes. And while in the past we used to think, it's gestational, so once the pregnancy's over, things should go back to normal. Now we believe that women who experience gestational diabetes have a 20 to 50% chance of developing type 2 diabetes later on in life, and so do their offspring. Probably the greatest threat to public health, in my opinion, is the existence of these type 4 diabetes, which is really pre-diabetes, or in other words, those patients who are diabetic but don't yet know it, or who are diabetic but whose blood sugars aren't high enough to be considered part of the class of diabetics. As a result, they will eventually become diabetics, or so we think, and so they run all the risk factors for potentially organ damage and microvascular complications, but not quite termed or diagnosed, and therefore may not necessarily seek treatment. All of that means you, the dental hygienist, are awesome. Why? Because you have the ability, as I've often said to my audiences, to save people from themselves. I don't say that in a pejorative way. I mean, these are folks who don't have a medical background, who don't even know the first thing about medicine or dentistry. And there you are, the perfect person to not only see the signs, but also refer that patient for medical consultation, and in so doing, save their lives, right? But save them from themselves. So keep doing all the awesome things that you do every day, and keep listening for more Fast Facts Pharmacology Edition. Our next episode is going to be more about the medications used to treat diabetes, and then also the microvascular and macrovascular complications of diabetes and how to treat them as well. Till then, my friends, Tom Viola here. See you next time. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.